name is Dr. Gallagher. I am a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. So I wanted to talk to you guys about a super important paper, a publication that just came out in the American Journal of Psychiatry from Sweden. And basically what this paper showed was that for transgender and gender nonconforming folks who want and need surgery, it does them good. Now, that doesn't sound too groundbreaking, but it actually is. Anybody like myself who works in this field, or friends or family or transgender folks themselves, will know that gender affirmation surgery is good for folks who need it. However, it is quite difficult to prove that. And the first thing is, in science, we have to measure things. And there's no good way to measure gender dysphoria, unfortunately. So we can't compare it to, well, your gender dysphoria was up here before surgery and now it's down here. We really don't have a great way of measuring it, although some people are working on that. So, whereas we intuitively know and we see it anecdotally every day in our patients, it really had yet to be quantified. Now, the cool thing about Sweden is they have a national registry, so it's a lot easier to track folks who are transgender out into the long term, because not only do we want to see that folks do well after surgery, but that this improvement continues. And so in this study, what they found was, no surprise, first thing was that mood disorders and anxiety are more common in folks who are transgender. Myriad of reasons for that. First of all, transgender folks probably seek help more often. Being transgender is difficult. There can be trauma related to that. There can be stigma related to a difficulty in society. So lots of different reasons that may happen. But the most important thing from this study was in folks who wanted to undergo gender affirmation surgery, and of course, full disclosure, gender affirmation surgery is not needed or wanted by everybody who is transgender by any means, but in patients who needed surgery and had undergone surgery, their mental health improved. And what they saw was, in the first year after surgery, there was they were 8% less likely to suffer from these mood and anxiety disorders. And indeed what they found was, in the long term, extending forward 10 years, this 8% decrease continued. So we're seeing over 10 years about an 80% decrease in mood and anxiety disorders. So there you have it. Gender affirmation surgery works. And this is a super important paper out of Stockholm. Congratulations to the authors, because with their hard work and long-term follow-up, they were able to prove scientifically what we all know.